Hi everyone, this is Divya from Quick Mommy Hacks, and today we'll talk about vulvodynia with Dr. Sophie Bergeron. So, thank you so much for joining us today to discuss this topic. So, I'll start with my first question. What is vulvodynia?
So vulvodynia is a kind of gynecological pain that is at the vulva. It affects 8 to 10% of women of all ages, and it's a pain for which doctors can't find an identifiable cause and that lasts at least 3 months.
So, how is it different than vaginismus?
So vaginismus is really the tightening of the muscles at the entry of the vagina that makes penetration impossible or really difficult. So sometimes you could have vulvodynia and also have vaginismus. So you have the pain and the tightening of the muscles, or you could have just one or the other. So a lot of women with vulvodynia do not have vaginismus. It's painful for them to engage in penetrative vaginal activities, but it's not impossible.
So, does it have any other name?
Yes, so vulvodynia can also be called provoked vestibulodynia, which is the most common subtype. It can also be called dyspareunia, which is just a term that refers to pain during sexual activity, but pain anywhere, not just at the vulva. It could also be called genitopelvic pain, which is a broad umbrella term for all sorts of, causes of pain during sex.
So, how does one know that they are suffering from vulvodynia? I mean, what does it feel like?
It really feels like a burning pain. So women will say, when I try to have sex, when I try to have intercourse with a partner, inserting an object, it really creates a burning pain. Some will say it's also like a cutting pain, like a knife. So you would definitely know if you have it.
Mhm.
It
So,
really hurts.
so, what are the possible causes of vulvodynia?
There are many possible causes, but we don't know, like, we haven't pinpointed a specific cause. So we know there are certain risk factors, so things in a person's life that increase the chance that they develop vulvodynia. So in terms of psychological factors, I'm a psychologist, there would be more anxiety, more depression, trauma in childhood. But there's also a lot of medical factors that are potential causes. There's more inflammation in the area. A lot of researchers also found that women with vulvodynia, they tend to have other kinds of chronic pain conditions. So they have what we would call like hypersensitivity to pain, not just in the vulva, but everywhere, many different places in the body, and hypersensitivity to touch. So there are clearly physical causes, infections as well. If you've had repeated yeast infections, for example, and then there's inflammation in the area. And a last factor is pelvic floor muscle tension. So we find that there are abnormalities in the pelvic floor muscles of women with vulvodynia.
So, are there any, I mean, does it cause any emotional problems as well?
It really can. It doesn't in everyone, but it can cause anxiety. So anxiety can be a risk factor, but it's also a clear consequence of having vulvodynia. So it can cause a woman anxiety. It can cause a woman to feel depressed, discouraged. A lot of women say that they experience shame, that they feel inadequate as a sexual partner. They don't feel like they're a real woman. So it really causes some emotional distress for women. Yeah.
So, how can you diagnose, vulvodynia by yourself if you were to look for symptoms, and when is the right time, like you should approach the doctor, and how do the doctors usually approach, the diagnosis?
So usually having sex is not supposed to hurt. So if it hurts one or two times, then that can happen to any woman. But if it hurts every time for more than 3 months, you have to go see your doctor, a nurse, some health professional. And that's how you would know you might have it, because it's been over 3 months and it hurts every time you try to have sex. And it's a burning pain. You can't really self-diagnose, but I mean, if you want to try, you can touch the area with a finger and at the entry of the vagina, and usually that's going to hurt too. But really, the best course of action is to consult a doctor or a nurse. And then what they do is what's called the cotton swab test. So they use a big cotton swab, and they will press all around the entry of the vagina. And for women with vulvodynia, that really hurts. So usually that's how it's diagnosed. And then it's also a diagnosis of elimination. They're going to test to see if you have an infection, like could it be caused by an infection, for example. So they're going to look for that as well. Overall, that's how it's done. It's really important to go see someone, even if you're shy to talk about it. You have to talk about it. It's really important. And doctors do know about it.
So how is it treated? Like, what are the treatments available for this?
So there are different medical treatments, like different creams or anesthetic gels, like lidocaine is one. There are medications as well, but none of those medical treatments have really shown to be very helpful. They're not, like, they can help a little bit, some women, but studies show they're not super helpful. What we know is more helpful at this point is pelvic floor physical therapy. So it's a form of physical therapy to reduce those tensions that I talked about earlier in the pelvic floor. And there's a really large study that was just published that shows that works really well. And the other treatment that's been studied a lot is cognitive behavioral therapy. So about 10 sessions of therapy. And that has also been shown now in many studies to work pretty well, either for the woman alone or the woman and a partner if they have a partner.
So you mentioned about, cognitive behavioral therapy as well, and also the medical, treatments. So when a woman thinks, there's something wrong, should she actually approach a gynecologist first, or she should actually approach both a sex therapist and a gynecologist to have like a proper treatment plan?
In an ideal world, you would like both. But in many parts of the world, it's just not possible to have both. So usually the first point of entry is your family doctor. That's the first person you would approach. And then, family doctor or nurse. Then a lot of them will refer you to a gynecologist. But some can treat it themselves. In fact, most can. And then sometimes they will refer you to a sex therapist or to a pelvic floor physical therapist. So in an ideal world, you do want the sex therapy or the pelvic floor physical therapy, but it's not always possible.
So are there any circumstances in which a treatment would require surgery as well?
Yeah, so surgery actually works really well, vestibulectomy, just for the one kind of vulvodynia, which is called provoked vestibulodynia that I mentioned earlier. It works really well. It's not a first-line treatment, right? So you use the surgery after you've tried, probably 2 or 3 medical treatments, maybe sex therapy, and you see no change in your pain. And then that's a gynecologist who would do that surgery. Yeah, but it does work quite well.
So usually in your experience, how long does it take for the treatment to, affect a woman? Like, how soon can they be treated?
Well, women should definitely not be afraid of getting help, because anything is going to be better than not talking about it and not getting help. And unfortunately, only about 60% of women who have it seek help. And you have to be persistent. If the first doctor you see says you have nothing, but you've had pain for more than 3 months, go see another doctor. You have to be persistent. It's really important. So and once you start treatment, it really depends on the woman. So some women will see quick results. So after 3 months of one treatment, they're already seeing a big improvement. Other women, they have to try 2 or 3 treatments before seeing an improvement. So the key thing is you want to stick with it. You want to be persistent, continue to have hope, because eventually you do find the treatment that helps you. And you want to work as a team with your healthcare professional. So find someone who will accompany you through this trial and error process, and then work as a team with your partner when you have a partner, that you're in this together and you're going to find solutions. You just have to be persistent and patient.
So, besides the professional treatments and everything that you mentioned, are there ways of managing that pain by yourself at home, or in other ways that we can manage the pain?
Really, any help you can find in relation to managing chronic pain. So now there are apps that are available for this. It can't hurt. Anything you find that is geared toward helping people with chronic pain, it's going to help the vulvodynia for sure. If, for instance, that would be the only help that you have access to. Another thing that can help is mindfulness. So there are studies, it's a form of cognitive behavioral therapy. So there are also now a lot of mindfulness apps. Some you have to pay, but others are free. So practicing mindfulness every day is also going to help. Another thing you can do if you don't have access to treatment is really, when you have a partner, is to start talking about it with your partner and tell your partner when it hurts. Assert yourself, tell your partner when it hurts, and say, can we stop and try like another position or try another sexual activity? You see what I mean?
Yeah.
To adapt your sex life. You shouldn't be having sex that's painful every time.
Yeah. So do you think like there are women who are more susceptible to it?
So we know that, so the findings are sometimes contradictory, but if I try to summarize, Hispanic women are more at risk. So these are studies in the US. Hispanic women are more at risk. And then younger women are more at risk. So we see more new cases in young women.
Okay.
Yeah. And then the risk factors that I told you about.
Yeah.
If you've had an anxiety disorder or a depressive episode, you're a bit more at risk.
So you mentioned about, the shame around this issue, and that women are kind of hesitant towards, approaching for help. So does it really affect the women's, state of mind, and also like her relationships, her marriage? And like, why do women feel such a shame, acknowledging that there is a problem and seeking help for it?
Well, that's a great question. I think there are still stereotypes in terms of what is a woman's role in a marriage, in a relationship. And a lot of women who have a male partner feel that it's part of their responsibility or their role to not provide, but to facilitate, an enjoyable sex life. And especially for younger women, it's also tied, to having kids. And so younger women are more distressed because of this, because they feel that it's really important for their relationship that the sex life is good. And if they have pain, they tend to blame themselves. But it's not their fault. It's not at all their fault. They have to know this. It's really important. It's no one's fault. And you have to tell your partner too that it's not the partner's fault and it's not the woman's fault. It's just like if you have headaches or back pain, you go see a doctor and you seek treatment.
So are there any ways of involving the partner into the treatment?
Yes. So you can do sex and couple therapy. We developed a 12-session sex and couple therapy, and we've shown it really helps both the woman and the partner in terms of their pain and their sexuality. But the partner can be involved in really any treatment. You know, they can go with the affected woman to her doctor, to her nurse, to the pelvic floor physical therapy. And I would say, based on all the work that I've done, that the more the partner can be involved, the better. And the education that the woman receives, like the interview we're doing now, you want the partners to hear this. It's important that they know what it is.
So, then coming down to the question of pregnancy. So, is it possible to become pregnant if you have vulvodynia?
Absolutely. Mm-hmm.
Mm-hmm. So, and can you like deliver vaginally in this case?
Absolutely.
I mean, is it just because of the pain and everything? So,
well, the pain of labor is not really in the vulva, right? It's the contractions that are painful. Mm-hmm. So it doesn't, labor for women with vulvodynia is not going to be more or less painful. You know, it's the same. Mm-hmm. I do know that some women are afraid. Women with vulvodynia, they're afraid of delivering mm-hmm. vaginally, and that's something, there's no basis for being afraid, but that fear is real, and it warrants then a discussion with the doctor who's going to do mm-hmm. the delivery to discuss the options, including mm-hmm. the pain management options.
So does pregnancy like really affect vulvodynia condition at all? Like, does it become worse, or, you know, does it affect it in any way?
We don't really know. There's not enough research, but anecdotally, some women have told me they're better after pregnancy.
Okay.
Mm-hmm. They feel their vulvodynia is better. So that's good news. And then other women will develop vulvodynia after a vaginal delivery. Mm-hmm. Mm-hmm. So actually, a lot of women have some pain after a vaginal delivery, but that's going to subside, you know, within mm-hmm. 1 year post-delivery. And a small proportion of women after vaginal delivery will keep having the pain. Again, in which case you have to go see your doctor, because it's not normal to still have pain 1 year after your delivery.
Mm-hmm. But during the pregnancy, does it like, you know, affect it in any way? Does the pain get worse, or, you know, it
not
remains...
that I know of, but again, mm-hmm. there haven't been studies where, you know,
okay.
you follow pregnant women with vulvodynia mm-hmm. before the pregnancy. So we just don't know. It does seem to be a kind of pain that is hormonally dependent. So some women will say, you know, I have more pain during ovulation, or I have more pain right before my period. A lot of women say during the period they have less pain.
Okay.
Mm-hmm. So women could see changes when pregnant, but we just don't know. You know?
Okay. Mm-hmm.
Yeah. Mm-hmm. But it's not a risk to be pregnant if you have.
Yeah.
If it's postpartum, wait maybe a bit more than 3 months, because usually you're going to resume sex after 6 to 8 weeks. So I would wait. If it's postpartum, I would wait maybe 4 months postpartum. But then if there's still pain, definitely I would see a doctor.
So lastly, mm-hmm. like, do you have any advice for women who have vulvodynia? And also for the partners, actually.
Well, don't blame yourself. Don't blame each other. Go seek help. Your pain is real. It's a real problem. It affects 8 to 10% of women of all ages. So it's a really common problem. We just don't know about it because it's more of a private problem, and women don't talk about it as much. But it's a very real pain, and there is help available. And be persistent and be kind to yourself.
Mm-hmm. And any advice for the partners? You know, how they can support?
Well, the same thing. So what we know is a supportive partner is better. Don't blame yourself. It's not the partner's fault, and it's not the woman's fault. And keep the channels of communication open. Talk about your sex life, talk about the pain, and support your partner who has pain in seeking treatment. And one last important piece of advice is don't avoid the problem. We know that when couples avoid, it becomes worse. So you want to be proactive. talk about it together and seek help together, and you'll
Mhm.
find a solution.
So yeah, those were my questions, and it was really, really informative to learn about this. Thank you so much for joining me. Thank you.
My pleasure, Divya.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.